Wazima is a valuable resource in today's digital world. It's a health tech platform that has an Africa vision. So it gives users access to medical practitioners in the UK, in the US, in Europe, and in Africa. Gone are the days where you had to go into a doctor's office or go to a surgery or a hospital to see a doctor. Nowadays, life is moving so fast, we don't want to waste any more time than we have to. So Wazima gives you the convenience of accessing the doctors as and when you need. Statistically, only about 35% of people who aren't feeling well need to physically go into a hospital and be examined. Usually it's lifestyle advice, a prescription may be needed, it just would be a general health advice. So 65% of the population that can use a telehealth platform are who we're focusing on. That's not to say that the rest of the population can't visit Wazima in order to manage their health. So we will help them have regular contact as they need with their specialist. You don't have to fly out to London to do a checkup.
Yes.
You can stay in touch with your doctor on our platform. Your medical records, for instance, are also portable. So you will be able to see what the doctor has written about your medical history, and you can take it wherever you go.
I would recommend Wazima, especially in areas of the world where we don't have the sort of health systems that we have in the UK, which is where you have the primary care that signposts specialist care. Wazima is a very good tool for that. And you find that people in such remote areas spend a lot of time, effort, and money seeking help in the wrong places.
I had been doing lots of work with the UN and the World Health Organization in Sub-Saharan Africa, and I noticed that people didn't have access to qualified medical practitioners when they needed them, nor did they have access to health information. So I was looking for a way to give access to as many people at the same time. We have seen where women have been coming to see the doctor with stage 3 and stage 4 cancer. And every time I would ask, why are you coming so late? Did you not notice some symptoms? They always did, and they always gave similar responses. They didn't know who to go to. They didn't know who to trust. They were afraid of the cost of treatment. So they stayed at home and they managed it themselves until they could no longer manage it. So this is another reason why I'm passionate about this, and making sure that every African has access to healthcare when they need it, and to qualified healthcare, because there are lots of informal health providers across Africa that do the people no good at all.
Anyone can use Wazima, even those people who are in areas where the health system is well developed. You can have consultations or advice in privacy, in the comfort of your home and at your own chosen time. In areas where the system is not that developed, Wazima fills the gap because you are able to get referred from a primary center to secondary care, or even a tertiary care, or even other paramedical specialties for intervention. So I think it's applicable to anyone. It has a place in all the health systems that are available.
Well, I'm a GP with special interest in dermatology, and I've been using Wazima for about a year now. Being on Wazima, well, it's really been great for me personally as a doctor. It's helped me to build an online clinic or practice, which, to be honest, has afforded me such convenience and flexibility that it's really improved my quality of life without reducing my earnings. It's also been hugely rewarding for me to be able to give back to those who ordinarily wouldn't have access to medical advice.
There are a few free services on the platform, including self-care, which helps users who have chronic and acute conditions like hypertension, diabetes, and so on, helps them manage their health, and there's support for pregnant women as well. We also have support for those who have fertility challenges as well on the platform, and of course the ability to see the doctor. Additionally, we wanted to make this more convenient, so it is possible for our users in the UK, for instance, to make a payment for their parent who is in a country, Nigeria or Ghana, in Africa. So you make the payment onto the platform here in London, and your mother or your father in Nigeria, Uganda or Ghana can use the platform. Every member of the family, from the youngest to the oldest, can use Wazima, but you would need to be 16 years old to use it independently. It's quite simple. To use the platform, you would need to sign up. It's a couple of steps. You would sign up on the platform, you would get verification email to your mailbox, you would click on that, sign in, make a payment, and access doctors as you need. The consultation process is quite straightforward. It gives users control. So whenever you feel that you need to see the doctor, you would sign into the platform, you would search through a list of doctors who are registered and signed up with us. We've got over 450 globally at the moment. You would book an appointment at a time that suits you, and the doctor would then accept the consultation, at which point the doctor can see your medical records and know why you need to see them and prepare before the consultation. At the appointment time, you would then be automatically joined in to the appointment with the doctor.
Getting signed up as a doctor on Wazima puts you on the world stage, really, because you can be seen and assessed from any part of the globe. Your profile is there. The world is your oyster, like they say. It has also provided opportunity for me to interact and collaborate with other subspecialties. It gives me a sort of a practice I have in a busy tertiary or secondary center. My patients actually have very good access to me. Patients, especially those that are far away from you, want to feel that you still think about them. So they want to contact you and making sure that you have a one-to-one rapport with them.
When I hear my patients in Nigeria say that their consultation with me has helped resolve their medical problem, well, that gives me a lot of satisfaction. I'd encourage every GP and other healthcare practitioners to sign up and join the Wazima Drive to improve the healthcare access and delivery globally, and particularly in Africa. The rates of pay are also competitive too.
The thing that makes me most excited about Wazima is the impact it stands to make and has already started making, because we've got families using the platform, we've had corporate organizations who already have seen up to 40% cost savings in time that they would ordinarily lose with their staff going to wait in a hospital queue. So we've bypassed that. Right there in the office, they can log on, see a doctor. In some cases, it's prescriptions that's needed. So the employee would get a prescription issued by the doctor they've seen, and the prescription is sent automatically to a pharmacy of their choice. Some pharmacies will offer a delivery service, so the prescription will be sent to them in their office. Wazima launched in beta testing mode in 2018. We've tested the proof of concept and had some really promising results and feedback. It's very easy to use, self-explanatory. You need an internet-enabled device to use it, and we've factored in the bandwidth, which is quite narrow in parts of Africa, so we factor that in to make sure you can get good quality videos and audio. Wazima is completely unique. We have factored in the end-to-end process in any normal consultation. Once you've seen the doctor is able to signpost you or triage you to the right person. So say you've seen a GP and the GP feels you need to see a specialist, you can then be referred to a specialist on the platform. You see a specialist, and the specialist feels that you need to then go to a hospital to have a physical exam or diagnostic test, X-ray, CT scan. You'll be referred on to doctors within hospitals that we partner with. So we've partnered with lots of hospitals, we've partnered with diagnostic centers, we've partnered with pharmacies, and there's an automated referral system. We've launched already in Nigeria, so we're live, we're being used, but our vision is Africa-wide. It's about impacting lives and changing healthcare across Africa for better.